Hey everybody, Jeremy with the Southeast Harm Reduction Project and Katie, the chronic pain kitty here. Welcome to our humble library. Today, in honor of Ehlers-Danlos Syndrome Awareness Month and International Harm Reduction Day, we're going to be talking real quick about overdose risk factors for people with chronic pain issues and other chronic health conditions. So stick around, we'll catch you on the other side of the intro. Talk on this channel a lot about addiction, misuse of substances, things like that, but there's a whole wide world of harm reduction out there, and one factor that's important to consider that's often overlooked is that people can and do overdose on their prescribed dose of opioid pain medications. Opioids are a class of medications that are primarily used to treat pain, and despite much of the recent debate and controversy over opioids, many chronic pain patients will attest to the fact that opioids are effective for treating both acute and chronic pain. And really that's up to them and their doctor to decide. Only they know how much pain they're in and what's effectively working to treat their pain. There are dozens and dozens of opioids, so we can't really go over all of them here, but here are just a few. This slide contains some generic names like morphine, fentanyl, methadone, oxymorphone, hydromorphone, oxycodone, codeine, hydrocodone, tramadol, buprenorphine, meperidine, and diamorphine. Wow, that's a mouthful, Katie. Some of the brand names for these include MS Cotton, Roxycontin, Oxycontin, Percocet, Acute, Norco, Vicodin, Lortab, Opana, Ultram, Suboxone, Butrans, Demerol, the list goes on and on and on. These medications are relatively safe on their own, however, they can contribute to an overdose, which is usually caused by respiratory depression, and there are certain factors that might increase your risk of an overdose, and here are just a few of those. Benzos are a class of drugs that are usually prescribed to treat anxiety, but also pain, insomnia, restless legs, and some other conditions. Again, this is a long list and brand names do vary. We've got Valium, Librium, Xanax, Klonopin, Lorazepam, aka Ativan, Restoril, Midazolam, aka Versed, Tegretol, Halcyon, Oxazepam. Again, there are many, many more. So research and always check what meds you're taking and how they interact with other medications. And our last class of medications is kind of a hodgepodge of central nervous system depressants, and these include sleep meds like Ambien, Lunesta, Rosarum, Sonata, and other things like alcohol, barbiturates, phenobarbital, sedatives, muscle relaxers like Soma, and gabapentin. And this isn't a complete list. There are lots of other central nervous system depressants. These are some of the most common. And another thing to keep in mind is that medications like Ultram or Tramadol, which are opioids, also impact serotonin, which is a neurotransmitter in your brain. And if you're taking SSRIs or SNRIs like Wellbutrin, Prozac, Zoloft, that sort of thing, especially if you mix with supplements like St. John's wort or 5-HTP, it can lead to serotonin syndrome. Really unpleasant, something that you don't want to mess with, can be fatal. And finally, what other factors or health conditions could put you at an increased risk for overdose? Well, here they are. Number 1, taking high doses of opioid pain medications or combinations of different opioids. Again, if you have a tolerance and you've been taking them for a while in the same dose, it's relatively safe. But number 2, combinations of meds, especially opioids with central nervous system depressants or anything that slows your breathing down. Number 3, lung problems or problems breathing, especially things like sleep apnea, which can be caused by Ehlers-Danlos syndrome or Chiari malformation, chronic obstructive pulmonary disease, aka COPD, and asthma. Number 4, recent respiratory infections like bronchitis, pneumonia, or the flu. Sometimes doctors will prescribe cough medications with codeine, which has a low risk profile, but it's still an opioid. It does cause respiratory depression. And number 5, chronic liver issues, unexplained weight loss, inhibition of certain enzymes, especially the CYP class, which Katie, that's a little bit out of my area of expertise. And drinking things like grapefruit juice or anything that contains bergamot, that also inhibits those same enzymes, and it can increase concentrations of certain medications in your blood. And finally, Naloxone, one of our favorite medications here at Sharp, is a medication that can almost always reverse an opioid overdose if it's administered in time. It's available by prescription from your doctor, and Check out this slide for more on naloxone access laws in the different states. In most states, people using opioids that they weren't prescribed can also obtain naloxone. And I'll put more on that in the description below, as I do in most of these videos. And I'll also include a link to our naloxone playlist that talks all about what naloxone is and how to use it. Naloxone is not a medication that you can self-administer, so if you're taking opioids, whether prescribed or not, it's always a good idea to have someone you live with or who can get to you quickly equipped and trained in how to use naloxone. Well, Katie, that's about it. So everyone, have a safe International Harm Reduction Day, and in honor of Ehlers-Danlos Syndrome Awareness Month, we'll put some more information in the description below. And as always, stay safe, practice harm reduction, and thanks for watching. Peace.